If you have a retiree health insurance plan, I'll ask a couple of things. Number one, does that retiree plan require you to join Medicare Part A and or B? Most retiree plans do require Medicare A and B once you are eligible for Medicare. So even though you might not want to join Medicare, the retiree plan might require it. I have seen a few retiree plans that do not require that, but most do require Medicare A and B, and by doing so, it saves your retiree plan millions of dollars every single year, okay? I will also ask, what are the coverage rules, right? So maybe your retiree plan does require A and B, that's very common. I will then say, well, what are the details of your retiree plan? Some retiree plans are structured like Medicare Advantage. Some plans are structured like Medicare, like original Medicare with a supplement. I want to know, what are the rules of the plans? How is it structured? Because not all retiree plans are your best option. This is important to look at because people assume that their retiree benefits are the best, and that's not always the case. For example, we oftentimes have teacher retirement plans, and many of those teacher retirement plans are structured like Medicare Advantage plans that are not great. So if our client has that Advantage retiree plan, they might say, you know what, between the cost and the coverage, I'd rather opt out of my retiree health insurance and just fully join Medicare. We have other clients, though, who are federal employees, and some of those federal employee retiree plans can be fantastic with Medicare. And so with them, we might still have them keep their retiree plan, maybe make a few tweaks, but also join Medicare Part A and B. I had another client, Craig, who works for a corporation. He actually had a really bad retiree package that I would not normally recommend, but because his wife is not yet 65, we kept him on that retiree plan for a couple more years, and we'll address the next steps when that retiree plan ends. Also, look to see, does that retiree plan cover any spouses or family members once you pass away? We've had clients on certain plans that when the spouse passes away, the other remaining spouse is no longer with health insurance, and it's an absolute nightmare. We had a professor who had the situation. He was a professor at a university. He passed away. As soon as he passed, his wife instantly lost her health insurance. It was not great. So again, please be thoughtful and thorough around your retiree plans to make that right decision, as they're not as simple as they were when it was an active employer plan.